framework Annex 3.
Next, please.
So we provide an example of Conops.
Annex 3.
And this chart now is very well, I should say very popular, because it's really helpful. So this is a 3-level module for the national Conops, and identify the types of decisions to be taken at each level. So, for example, on the right side, I added a chart like from the different level according to the scale of the event, the resources required, the coordination required. You go from the tactical level to the strategical level. Now, if we moments ago we showed the hierarchy of the plans, and then one plan called the disaster management plan, that at the state level or the national level, the top one. After that, there is a Conops, the national Conops. So now let's talk about the Conops at the national level. What is this document is about? So the national Conops, we already mentioned that the Conops, the difference between Conops and the plan is that the Conops should be part of the plan. And then we have the national disaster, the management, the framework, and then Conops can be part of that. But also, you can also have a separate document, but it should be linked to the national disaster management framework. And then this national Conops should define the intended operation of the entire emergency response system, not only the public health emergency. So how multi-sectoral and transnational coordination will work at the 3 levels. So in a handbook, we defined that the national Conops should have the 3 essential elements. That is all intended levels, like from a tactical, operational, strategic, you need to describe. So that and the players at each level involved in the response and the preparedness and response management, and where each responsible organization fits into the response system. It should provide a brief description on the authority structure or the metrics for decision making, and also describe when at what level, by whose authority, the PHEOC will be activated, or the other national EOC be activated, depends on the hazards or the nature of the emergency. So also the national Conops should identify other government departments or ministries who are the primary or secondary partners in the public health emergency. So whether they have the roles of lead or the supporting. Next. Sorry, a bit slow. At the strategic level, what the strategic and public policy level, the responsibilities are. So at this level, in the Conops, we say for this level, we define what their responsibility. At this level is to provide a high-level direction for the response, determine the need to declare a national level emergency, determine when the state of national level emergency has ended, makes and endorses policy required, establish national and multinational objectives. This is for all the events, but specific, if we regarding the public health emergency, the same. And also develop national level plans to support objectives. and coordinate the response of national level agencies from different ministries and the partners. Monitor the operational coordination and the implementation of the strategy. Ensure provision of human resource and other capabilities needed. Prepare and approve public communication materials, technical guidance, and activities. So the Conops at this level should have a brief discussion about the arrangement of all the responsibilities. So in the chart, we see at the top, we have the strategic level, operational level. But we also noticed that in some countries, the operational level and the strategic level, they combined, especially when the resources are limited. But in most of countries, that the high level, the strategic level, stay with the National Disaster Management Office or the similar agency. A close coordination and timely information exchange is required between the National Disaster Management Authority and other responding agency. For example, here we can see that the health part, we also have other, if you have other department like the nuclear or the radiation or the other clusters like environment. So next, please. Then at the operational level, which most of our PHEOC team is responsible for effective coordination of response elements and maintenance of situational awareness of strategic for the strategic level authority and all the partners. And the Conops should also define or provide a brief description of the responsibilities of this level. Is that how to provide the technical lead for the operational response based on the strategic guidance developed at the upper level, develop the operational level plans to meet the strategic objectives. The example we see like the strategic plan, and then each country will, or each WHO office will develop accordingly the plan at the operational level. Coordinate the response of the agency with other responding agency. Control and maintain situational awareness of tactical units and their actions. Prioritize and provide resources to support the tactical response. Provide the common operating picture. Next, please. So in this in the framework, so the operational level is in the middle, as mentioned. So the most of the public health EUC stays in this level. But in some resource constrained countries, the operational level EUC may stay with the national level EUC, the structure. So for example, the National Disaster Management Authority, they also maintain EUCs, and which can also lead the PHEOC, the PH emergency. And mentioned in some setting, the operational and the strategic level responsibility also can be combined into a single EUC. This all depends on the context of your organization, of your country. And if there's other ministers are that maintain the EUCs should be communicated with this PHEOC so that to ensure the situation awareness and coordination of the leading agency and the supporting agency. Next, please. And sorry. So at the tactical level, do what is to direct responsible direct management of human and material resources to achieve the objectives, and it's responsible for day-to-day tactical actions. And we say that the major task at this level is to action based on the incident action plans. So the plan that we discussed before by Osman is should be focused on the measurable, achievable actions, and should define the operational period, and should define what mechanism was used to manage the resource and to achieve the result. And this level should be located as close as possible to the incident, maybe at the district or community level. May take the form of a mobile or temporary command post, or the EOC staff by all agencies that from the supporting agencies, from the the coordinating agencies can come here together at the regional, like in WHO. Sometimes we establish we call the 4C room, command and control. The room on the site to coordinate with all the agencies at the local response site. Okay, next, please. So in this chart, we see that the tactical level, and also as what we discussed at the strategic and operational level, this level also may combine with the operational level based on your context. But we must stress that all the tactical decisions should be made at the tactical level as lowest level. And then the high level, operational level, or strategic level should avoid to intervene or interrupt the decision made at the tactical level to ensure the efficiency. Next, please. And also in this module, we talked about incident and grading. So because in the Conops should also describe how briefly the grading system and the process. So the emergency grading of the level of risk associated with an incident or emergency. So it's by the geographic extent, complexity, severity, etc., and the required resources. It should start immediately upon detection at the signal level, and to the alert to ensure that the response is appropriately resourced. A response is resourced. So it should be a continual process to ensure necessary escalation or de-escalation of your response. It should be based on the increasing level of response resources required and the trigger escalation level. So next, please. So now we come to the Conops for the emergency operations plan. And in the framework, we say it's the same thing, but we do see difference from the EOP and the ERP, and the framework will be revised based on the feedback we received. But for now, we say the EOP and the ERP can be either interchangeable. So in the emergency operations plan, the Conops, the function is to describe how and when to engage different branches and levels of government, as well as other partners in the incident management system. So the responsibilities of the designated organizations at the three levels, from operations point of view, and the structure and organization of the overall response, which usually means the incident management system, how, like what we showed in the first example from the WHO strategic response, preparedness and response plan. And the grading of the event to determine necessary level of response, the nature of escalating level of response, how the components of response work together. So once again, the Conops should be a summary or briefing of all these elements. And then details of all this responsibility should be detailed in the EOP, in the other sessions. So next, I would like to present another example. So in WHO, our operations are all implemented according to this emergency response framework we call ERP. So this framework defined the WHO's core commitments in emergency response. For example, is undertaken timely, independent, rigorous risk assessment and situation analysis. So how to do it based on a commitment? Then there is the statement about our operational structure is to, when responding to an emergency, WHO has clearly defined functions that reflect its responsibilities under the RHR and the Interagency Standing Committee's health cluster approach, as well as the expectations of member states and partners. And it defined that, very briefly, the response functions are operationalized through the incident management system. So previously webinar, we talked about the incident management system, which is modular, adaptable, flexible. So here we can see that in WHO, our IMS has 6 functions. So the leadership, partner coordination was taken from the management functions, split it into 2. And then we have the same information and planning. We have health operations and technical expertise, operations support and logistics, finance and administrations. This is all based on our own structure, the WHO, the business structure, and then adapt the IMS. Next, please. Okay, so in this Conops, we also need to define, how the levels of response and then the grading of your event or emergency. And in this framework, we have the high-level description like this Conops chart, how to do a risk assessment, how to link to the operation response. So the grading, and then at what level you decided your response level. And also this document provide a very brief description of the WHO response level, the emergency, the event, how do you say that? The emergency, the event grading level. For example, we have every day we monitor the thousands of events at WHO HQ and regional offices. And then some event they will trigger the grading process. And then in this framework, we define what are the triggers. So is that unusual, the scale or the political attention or the potential impact. So this document defined first in briefly, then detailed. So for the first, the brief description, we can call it a concept of operation. And then also the document describes the timing, the process, who is doing it, the responsibility of each level, and then who is declaring the grading and how to communicate. And then how the review process is being conducted. So all these kind of details are in a document, but also further details will be at each level have our own operations plan and then detailed at a different level. But the Conops will be in this framework at the higher level. Next, please. Next, please. Okay, so finally, let's look at the Conops for the PHEOC plan. So the Conops as the same for the national national plan or the emergency operations plan. The Conops for EOC plan also describe briefly how the EOC is expected to operate in a larger external context. So it should briefly describe the EOC operational structure, roles and responsibilities, the operations module, like we have some EOC clearly define that what are the major, the responsibilities at the watch mode, at the alert mode, at the response mode. And then also provide a direction and control alert and warning and continuity matters. You describe how you are going to do it. And also the activation levels and the process within the PHEOC. So how the things are intended to work, all the above, and then the relevant internal management process. So even though all the details will be provided in a plan, in a separate session, the sectors or sessions, but it's very important to provide a brief Conops to enable your audience understand immediately, especially those people coming to the EOC. Okay. And also just trying to emphasize the national Conops or UP Conops should be available in a PHEOC, either in the annex or provided in the EOC so that people can refer to. Next, please.
And Gian, just a reminder that we may have to wrap up shortly to go to Q&A, just for
Okay.
the other presentation as well. So just another minute or two.
Thank you. Okay, so we come back to the first the chart. First of all, you decide which level the EUC you are having. And we mentioned that at the national level or the PHEOC level, we may be the combination of operational strategical level together, or we may combine with the operational or technical together, depends on your context, your mandate, and your constraint. And first of all, we also look at what the objectives that the EUC set for the EUC by the all the stakeholders, and then we see that in the EUC plan we mentioned that the Conops is really a statement in a plan. So when we plan our response, all the plans actually should have at least some statement of the concept of operation. And in this chart, we can see that the many plans that can provide details. If you provide the Conops, and you can have many kind of the detailed plan to describe the responsibilities and process. So I will skip this operational structure as we mentioned before, and in this presentation, which will be posted at the Discord platform, you will see a lot of examples from previous presentation about the operational structure for the Conops. And then lastly, I would like to also provide the useful resources for your further reading. And the first is, of course, our UCNet, the web page, and including some documents mentioned. And also, yesterday we just published the Open WHO course on the PHEOC, and it's now accessible. And the last, but the most important, is the community of practice Discord platform. Over. Thank you.
Great, thank you, Gian. Really appreciate the presentation. I think for the sake of time, I'll go with one question, and then hopefully, once our other colleagues finish their presentation, we'll have some more opportunity for all of our presenters and panelists. The question I'd like to ask is, or the question that was posed in the chat, is from your experiences, can you describe where active risk assessment fits into the Conops plans, and this especially as diseases are changing, or sanitation will change based on natural disasters or other elements. Can you just describe that a little bit further for our participants?
Okay, thank you. This is a very good question. And actually now in WHO, we are building our new UC. And one of the question is where the risk assessment team should sit, the functions should sit. Should it be with the UC or should not? Or should it be in the current position where it is with the health information in the department? So it all depends on your organization, the context, but and then how, if you see the gaps, the current system not working, you may think about to create the Conops for your leadership. Say, okay, we would like to move it to where, but the Conops will describe so where this function sit, and because it's so important, and you have to plan carefully where to combine with the sitting in the EUC, or the EUC be the end user of your risk assessment result. So that's all depends on your, I think, the context, but the really careful analyze of the gaps, the needs to make that decision. Thank you.
Great, thank you, Jan, and thank you for your wonderful and insightful presentation. We are now going to move on to our second speaker of today. Today's second speaker is Ulrike Grotti. She will take us through our presentation on developing and using concept of operations in PHEOCs in Germany. So take us through a bit more of a country-specific example and context. Ulrike is a teacher and public health specialist. Since 2016, she has been working as a scientist and trainer at the Department for Infectious Disease Epidemiology at the Robert Koch Institute. She has experience in crisis management, simulation exercises, and after-action reviews, preparedness response, infectious disease epidemiology, surveillance, risk communication, and in the development of trainings. She is also involved in many training activities, including preparing for those simulation exercises, and is currently responsible for management of emergency operations at the Robert Koch Institute. So without further ado, we turn it over to you, Ulrike, for your presentation. Thank you for joining us.
Yes, thank you very much for the opportunity to be here. It's really good that we are able to join here, and I'm really glad that I can show a little bit our Conops we have here in Germany, especially at the Robert Koch Institute. Next slide, please. Just as a little background, so Germany is a democratic federal parliamentary republic with around 82 million inhabitants, and we've got 16 federal states. And those states are further divided into rural and also urban districts. And next click. What is important to know that because you have a decentralized system, and so that means that we on a national level, we don't have the power to implement any measures. We can support the federal states, but it's not our responsibility, or we can't really go there and implement measures or yes, so the first response is always on the local level. Next slide. Here you can see that we've got the federal government and we've got different ministries at the federal level. And during this, they all have their own concepts of operations. So for example, now during Corona, the Federal Ministry of Health meets in joint crisis committee meetings together with the Federal Ministry of the Interior. And the Robert Koch Institute is an authority within the portfolio of the Federal Ministry of Health. And due to the structure with the portfolios, it's not like that if the Federal Ministry of Interior, for example, has got a question or a task for us, they can't contact us directly, but they have to go through the Federal Ministry of Health. So for us, the main contact point on the level with the ministries is always the Ministry of Health. This is in peacetime, but also now during Corona. So that hasn't changed, and this is a concept of operations which is like always has been there and will be there. Next slide. This shows you the structure we have for notifying events to the WHO. So we have one joint information and situation center. That is our EOC and contact point for the WHO. And this joint information and situation center belongs to the Federal Office of Civil Protection and Disaster Assistance and lies in the portfolio of the Federal Ministry of the Interior. And depending then on the pathogen, we have different institutes involved in the response. So for example, if it's a radionuclear threat, then the local health authority informs the state health authority, and via the Federal Ministry for the Environment, our Joint Information and Situation Center is informed. And the same for chemical agents, it goes also via the local and state authority and then through the Federal Office of Civil Protection and Disaster Assistance. And in case of a biological event, the RKI, the Robert Koch Institute, is involved, and we are in very close contact with the Federal Ministry of Health. But in this case, we can also directly go via the Joint Information and Situation Center to contact then the WHO. Next slide. Yes, can you click maybe a little bit because we have lots of, just, yeah, more and more. That's easier. Yeah, that's perfect. So this is out of our emergency preparedness plan of the Robert Koch Institute. So we have a 3-level, we have got 3 levels depending on the severity of the situation. So if it's the severity of the situation is low, for example, if it's just an outbreak in one city or one state or something like that, the crisis manager in charge is the head of the responsible unit. The decision panel is also the responsible unit, and the organizational support is also within the responsible unit. So everything is in one unit. And if the severity of the situation is higher, like medium, then a working group can be established. The head of the working group is usually the head of the department at our institute. And for the organizational support, we can also have a coordination office. For COVID-19, the coordination office was activated on the 14th of January. The working group already on the 6th of January. And if the severity is high, we can have a crisis committee. The head of the crisis committee is always the vice president of the Robert Koch Institute, and he is a crisis manager in charge. And on the strategic level, we have the crisis committee. And as an organizational support, we have the Emergency Operations Center, which was activated on the 28th of January here in Germany, with the first case in Germany of COVID-19. Next slide. So how do we decide whether we need an Emergency Operations Center or a coordination office? Well, there are a couple of indicators we use, like, for example, the number of possible affected persons, but also the severity, geographic distribution. Is it just in one city, or is it just in a state, federal state, or several federal states? Then, of course, the public perception is very important because, for example, we already had a coordination office active at our institute when there was Ebola in West Africa, for example, because here in Germany, everybody was scared of Ebola, and so we said, okay, it's always good as well to be a little bit in front of ahead of the situation, meaning that we already can prepare some documents like, for example, what would happen if a suspected case comes to a hospital? What should we do? And of course, the internal workload of the Robert Koch Institute, which also, together with how many units are involved. So we don't have like fixed predefined criteria for the escalation. So we don't say like, oh, we've got 100 emails per day, so we will open our emergency operations center. But we say, okay, it's like a discussion process, and those are the indicators we use for that. Next slide. Coming now to the 3 levels of the WHO framework, there's the strategic level, the operational level, and the tactical level. On the strategic level at the Robert Koch Institute, we've got currently our crisis committee. The incident manager of this crisis committee is a deputy president of the Robert Koch Institute. And in this crisis committee, there are different, the head of our different departments, as well as representatives from several units, especially, for example, for the unit for respiratory disease, for surveillance, hygiene, laboratory, but also representatives from the press department. And this crisis committee meets currently 3 times online per week. And also in this crisis committee meeting, the Federal Ministry of Health, as well as the Army and the Federal Center for Health Education, they also participate. And this is also because then, for example, we can exchange what kind of communication message we should have. The task of the crisis committee is the situation and the risk assessment, but also providing the strategic direction for the Robert Koch Institute for the response and general decisions, like, for example, what kind of recommendations do we need? What should our communication message be? What kind of resources do we need? Are there any documents we need to establish? Or also what kind, if there are already documents, they are also responsible for the approval and also of the approval of communication materials. Next slide. On operational level, we've got our Emergency Operations Center, which is currently operating from 8:30 until 6 in the evening, and on weekends from 10 to 3. We only have got 1 email address and 1 telephone number. And we've got one position, the triage person, we can see on the right, who is responsible for screening this email address and also answering the telephone calls. We only have one email address and one telephone number because this is also the contact details the other ministries have, the Federal Ministry of Health, and it's our task then to distribute the information or the questions within the Robert Koch Institute. So it's like really like the single point of contact. And the task of the Robert Koch, of the Emergency Operations Center at the Robert Koch Institute is the overview and the documentation of the situations, including the activities at the Robert Koch Institute. This is done by the position situation protocol. Then we provide technical support. We coordinate the response with the Federal Ministry of Health, so we are in contact with them and with others. We create the daily situation report. We also answer inquiries by the public and the professionals. We have one position outside the EOC, which is responsible for outbreak screening. So we screen the media for more information on high incidents in special cities, for example. And then we've got one position for monitoring the local contact tracing capacities. So they ask the health authorities whether they still have enough people for the contact tracing, or whether they have a shortage or a shortage in the future. And then we've got a position called international communication and contact tracing, and they are in close contact with the other countries, either via the WHO or the European. We've got in Europe an early warning and response system, and they also share, for example, the personal data with the other states, and also if we receive personal data for contact tracing from other states, they also transfer this data to the local health authorities. Next slide. Yes, so you can really say our EOC is like the communication and coordination hub. We are in close contact with other ministries, but also with the WHO, with other scientific institutions, with other sister institutions, and so on, with the federal states. But we are also in close contact within our institute, within the Robert Koch Institute, as you can see on the top. And therefore, we need, of course, a chart where we can see whom we have to contact. And this is on the next slide. Here you can see, this is our internal chart where we can see who is responsible for what. So we have in red, the persons responsible for the management, for example, for the public health EOC, but also for data protection, for legal issues. And then you can see in this chart, you would have always the name and the contact details of the telephone number, email address of the person responsible for that. And then we've got different topics in blue, like epidemiology, diagnostics, infection control measures, and so on. And there you've got also different subtopics, like, for example, points of entry. Then we have for communication in purple, also, for example, newsletter, but who's responsible for the web page, for the FAQs, and so on. And then on the right, we have others, like, for example, who's responsible for the COVID-19 dashboard. Next slide, please. Within our Robert Koch Institute in the EOC, we also have some detailed standard operation procedures. We have got one general manual on the work of the EOC, where we have the description of the positions, but also helpful advices like how should the signature look like. We have flowcharts, for example, how to handle incoming information. And we also have already prepared, we already have used that in simulation exercise, situation protocol, the protocol for the tasks, and the telephone protocol. And we have on the right, you see different folders. For each position, we have a folder. And the colors of the folder are also the colors we use in our email account. So I said we only have got one email account. So to make clear which position has to work on which email, we use colors. So for example, red is for the head of the shift. And you can see there's also a red folder that is one of the head of the shift. And the same, there's a purple folder for the situation report. And those are the colors we also use in the Outlook then. Next slide. Here you can see that is a flow chart for the person doing the triage. So we received an email at our EOC, and then this person doing the triage has to screen the email, has to have a look who has already received the email, but also what is the content and is the email urgent? And then he or she on the position has to decide if no forwarding is needed, then he or she can just tick the email. But sometimes forwarding is needed, then it's good to have a short description of the content and maybe also, if necessary, delete the email history or the distribution list when forwarding. And then the email can also be ticked. And sometimes an action is needed. For example, it's an information for the head or of the shift, or is it something, maybe it's something we have to put in our situation protocol, or for the person who's doing the to-dos. So if you, for example, received an email from the Federal Ministry of Health asking for reviewing a document, then we have an Excel sheet where we have IDs, and we give out tasks, and we send out the task to the person who can review then the document within the Robert Koch Institute. And so this person on the triage has to use the colors accordingly, and then if necessary, also if it's an urgent email, they also point out to the position that's an urgent email, and the person doing the screening does not tick then the email. This is done by the person who received the email. So yes, next slide. So we have now on the left side the strategic level of our Robert Koch Institute here, and on the right side we have the operational, and in between we have also a link. We have a position called head of the EOC, and this position is a person who knows what's going on in the EOC, but is also part of the crisis committee and joined the crisis committee meeting. Next slide. So on the technical level, as I said in the beginning, so the response and the measures are implemented at local level. For example, the contact tracing, the case investigation, the decision on the closures of the schools, that's all done on local level. But on request of the federal states, the Robert Koch Institute can support outbreak investigations, for example. And then there was, during Corona, an initiative that we got containment scouts. Those are people, usually like, for example, students, who are helping out the health authorities with contact tracing, and they were employed level by the national level. And then we have regular communication exchange with the federal states. So, for example, we've got every Tuesday a telephone conference with all federal states. That was also already implemented in peacetime. So we have it already like over 10 years, every Tuesday. It's that we meet together with the federal states, and they can talk about outbreaks, and also now, of course, about Corona. And if they've got questions regarding documents, we talk with them about that. And during Corona, we also had it not only on Tuesdays, but also on Thursdays. But we also have exchanged with the political sides with the federal states. For example, there's also a telephone conference. And this was also implemented already in peacetime. So we use lots of instruments which we already had during peacetime. And with that, my presentation is already over. Thank you very much.
Great. Thank you for that wonderful presentation. It was really great to have that context, particularly in the experience that Germany has gone through and the process. I think at this juncture, I'll open it up, I think, to some specific questions for each of the presenters and our panelists. But if anyone has anything to add, please don't hesitate to jump in. So I think the first question that I will ask, and I think this one would go directly to Ulrich. There was a question about the emergency response framework, and they noted that it's very clear and gives good structure. But they were specifically inquiring as to medical consultants and if the emergency number or email address is available for addressing issues sort of at the health institution level. So in hospitals, such as things like bed capacity and otherwise. I'll turn it over to Ulrike or Ariane for a response.
I'm not sure if Ulrike is still there. Otherwise, I can attempt to answer and she can add if she likes. So since we have a federal system, the things like hospital bed capacity and resources in each of the federal states are handled by the federal state's government. So this is not done in a centralized measure. What we have now since the COVID-19 pandemic is a system that aims to gather information on the occupancy of hospital beds, intensive care beds, and so on. And these data are being collated on a weekly basis. And they're also available in our daily situation reports. I will maybe put in the chat the link to our daily situation reports, which are being published since March in 2 languages every day. And once a week, I think we include information on, for example, hospital bed occupancy, but this is not regulated from the national level. I hope this is clear. Thank you.
Great. And I think you actually prompted another theme or discussion that we've seen in the chat. And I also look to our colleagues from our RKI to potentially answer this as well from your experiences. You noted a little bit about the legal structure and then the federal states and how this impacts the process for thinking through your structure, development of the Conops, and that process. Is there anything else that I think that you could add for participants, just in terms of the process in Germany for ensuring that the Conops structure is in line with legal instruments or mandates for emergency response operations? What does that look like, and how does that take place? Any additional information you may be able to add?
Sure, I'll try. I'm not an expert on the legal side of this.
Understood.
But, we have, for example, to start with, we have, of course, the infection protection law that regulates everything related to surveillance and data transfer of infectious diseases. We have also, for example, a law that says how the IHR are to be implemented. So the IHR implementation is also grounded in Germany by law. So these are things that were already before the pandemic in place for this. And there's other laws that come into action when there is an epidemic situation like we have now. For example, in the beginning of the year, our institute, the Robert Koch Institute, got the legal mandate for the coordination of the response. Nevertheless, it still remains the case that everything that is related to the response directly at the bottom, so the tactical response